So this whole idea of genuinely involving people in big decisions, healthcare, research, services, it always sounds fantastic in theory, doesn't it?
Oh, absolutely. Sounds great on paper.
But then when it comes to actually doing it effectively, well, it often becomes this really complex puzzle. A lot of organizations seem to wrestle with it.
Yeah, how do you move past just, like, checking a box?
Exactly. How do you really bring people in? And that's actually what we're diving into today.
Patient and public involvement, PPI.
Right, PPI. We're looking at this fascinating study that tried to cut through all that noise to figure out the core principles for making PPI work, moving beyond just compliance to real impact.
Getting down to what really matters.
Yeah, so you'll get a clear sense of what's absolutely essential and maybe what's more desirable, aspirational.
And we're digging into research by Baines and Regan de Beer from 2017. It's quite a unique study, actually.
How so?
Well, they did this big systematic review, looked at published papers, but also that gray literature.
Like reports from charities, government bodies, that kind of thing.
Exactly. Stuff that doesn't always make it into journals. And then they combine that with a modified Delphi method.
Okay, so bringing experts into it.
Yeah, they tapped into the experience of 18 PPI experts from all sorts of different fields. A really interesting mix.
So the first thing they found was this common problem. Loads of good intentions, but not much clarity on how to do it well. Like no real agreement.
Precisely. The study really highlighted that. Despite everyone agreeing PPI is important, there was this, vacuum when it came to agreed upon best practices. The how was the big question mark.
Right.
And what's fascinating is how they tackled it. This modified Delphi method, essentially, they got those 18 experts talking, but anonymously, over 3 rounds.
Anonymously, okay.
Yeah, helps people speak freely. And they work towards building consensus, setting the bar quite high, 75% agreement needed.
Wow, okay.
It really helped distill all that experience into some clear guidelines.
That's smart. But I heard they hit a bit of a bump early on, something about ranking the principles.
They did, yeah. Initially, they asked the experts to rank them, but it got tricky really fast.
Why is that?
Because PPI isn't one size fits all, right? What's crucial for, say, a local patient group advising on services might be different for a big national research project. The contexts vary hugely.
Makes sense. So what did they do?
They adapted. The research team and the experts worked together and decided to shift gears. Instead of ranking, they categorized principles into essential, like the absolute must-haves and desirable, the things you should really aim for.
Ah, okay. That pivot itself sounds like a good lesson.
It really is. Shows how research needs to be flexible in the real world.
So that shift led to some really core insights. Let's talk about those essential principles, the non-negotiables for PPI to actually work.
Right, so 9 principles made that essential list. And what's really striking is where the highest agreement was 94.1%. Massive consensus.
Okay, well, were they?
2 things gave that top score. Working in equal partnerships built on mutual trust, respect, and transparency. And crucially, sharing information, experiences, knowledge, and power.
Power. That's the big one, isn't it?
It really is. It's not just about inviting people along. It's about fundamentally shifting that balance. The study suggests that for PPI to be real, you have to tackle those traditional power dynamics head on.
Which can be uncomfortable for established ways of working.
Deeply uncomfortable sometimes. It requires a real institutional shift, not just surface changes.
So involvement without shared power is basically just tokenism.
Pretty much, yeah.
What else was on that essential list?
Other key things included communicating really clearly, truly listening, and importantly, responding. Supporting and preparing everyone involved, not just the patients or public members.
Probably professionals need support too.
Exactly. Also, openly acknowledging the value people bring, accommodating different needs, evaluating things as you go, not just at the end, and tailoring the approach to the specific situation.
Okay, so that's the bedrock, the foundation.
Those are your non-negotiables for any credible PPI effort.
So if those are essential, what about the desirable ones? The principles that take it from just doing PPI to doing it exceptionally well.
Yeah, 4 principles landed in the desirable category. One expert in the study actually put it really well. They said these aspects may not always be achieved, hence they can only be desirable.
Ah, so more aspirational, maybe harder to guarantee.
Kind of, yeah. They include things like committing to working together long-term, not just for one-off projects. Properly resourcing and investing in PPI, which often gets squeezed.
Budgets, always budgets.
Tell me about it. Also, truly empowering everyone involved, going beyond just basic consultation. And being proactive in outreach, making sure you're getting diverse voices, not just the usual suspects.
So these desirable ones, they're about deepening the commitment,
Mhm.
making it more embedded.
Exactly. They represent that next level. It's where PPI moves from being a process requirement to something genuinely transformative. But they often demand that deeper, sustained organizational commitment and, frankly, cultural change that's harder to nail down consistently.
It really makes you think, doesn't it? We've probably all seen situations where things like clear communication or valuing input seem obvious, but they fall by the wayside.
Oh, for sure. It
Huh.
turns good intentions into frustration pretty quickly.
These aren't just abstract points. They're the friction points in real
Well,
collaboration.
absolutely. And that's why this study is useful. It's not giving you a rigid rule book because, like we said, context matters.
Right.
Instead, it's offering these universal quality guidelines. Think of the essentials as the foundation you must build, the desirables. They're what makes the structure truly excellent, what elevates PPI to be a real driver of change.
So this deep dive really shows how solid research can take complex stuff like PPI and boil it down to clear, actionable principles. Understanding this difference between essential and desirable gives you a much stronger framework for improving how you might work with patients and the public.
Definitely provides a clearer lens.
So a final thought for you listening. As you think about collaboration and involvement, maybe in your own work or community, how might this distinction, essential versus desirable, change how you approach things? And maybe what steps could you or we take to make more of those desirable qualities become essential in everyday practice?